Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental practice brokerage for 14. Today's topic is preparing your dental practice for a sale with better odds of success by changing the patient mix of private fee-for-service slash PPO insurance slash out-of-network benefits. We're going to get into that now. As you know, we're doing this now with 14 years doing the dental practice brokerage. We have 10 employees. We're in 24 states. And we are also available to you now 363 days a year. We're traveling all over the country, too, for practices. And we attempt to visit virtually every practice we sell. We're going to come in and visit it and meet you. Find out what you're about, what your practice is about, what the area is about. So we're going to come and visit. You can reach us at 201-663-0935. And you can also hit our website at dentalpracticeguide.com or nationwidedentalpracticebrokers.com. Everything you're about to hear today is for entertainment purposes. It's not legal or business advice. If you're thinking about selling to a DSO, call us. We work with them all the time. We're independent of them, but we know what's going on, who the best ones are, the problems with certain ones, who's having trouble getting financing, who's losing their employees because they've stopped buying, everything. So give us a call. And often they will pay our commission, so generally there's no commission to you as a seller. And when you work with us and your practice is selling for $1 million or more final sale price, we will reimburse your legal fees upon successful closing. So we've done that multiple times. Give us a call. So what do you have to do to prepare your practice for the better patient mix? Because we may be entering very difficult economic times. We're in fall of 2024. I don't know which way the political pendulum is going to swing. But it's possible if the Democrats get in, times are going to be very hard. They'll increase the taxes, the border, nothing, it's not going to end. So we may be in for difficult times, and you should be prepared. Now, if you are relying heavily only on PPO insurance, don't forget they're getting those from their employers. You may indeed have businesses going out of business, and all of a sudden you've relied on this steady stream of PPOs who, because you accept that they come in, you're not marketing as much because you're just relying on them. And that's a big problem when you're relying on an outside source to get all your new patients. So what we're suggesting is, first of all, the overhead's crazy nowadays. The profits are down, and people are feeling it, especially the 55 to 70-year-olds. They're feeling it because they used to have a situation where they were not discounting their fees. And now they're discounting them because the insurance companies, the PPO insurance companies are not increasing their reimbursement. They're not raising the level. So you have a situation here where if we hit into difficult economic times, which is predicting to happen, you've been relying on the PPOs and not advertising because you belong to their group, you could be in for a great awakening. You as a seller, now economically you're going to be affected. So what we're saying is, and what we're seeing is trending towards getting a mixture, a nicer mix, healthier mix of fee-for-service, out-of-network benefits, to make your practice more appealing. I'm not saying drop all the PPOs. I'm saying give a better mixture. Maybe less PPOs, more out-of-network benefits, and more fee-for-service. I think this is something that will make your practice more appealing, certainly in the future. And if we hit economic times, you will be prepared. The reason you'll be prepared is because you would have already done your advertising, marketing, and your new patient growth have been set up already for marketing to the the non-PPO patients. You would have had your system set up, your staff is set up. It's also, don't forget, a fair number of PPO patients don't want to go outside don't want to pay too much for out-of-pocket. So your staff gets accustomed to that. They're not going for tooth whitening, they're not going for extra procedures, they're not going for sleep apnea. You want to set yourself up so that your staff is accustomed to patients that will go for that, and they have the incentive to attempt to get the patients to get needed dentistry, but may not necessarily be covered by the insurance all the time. So it's an important thing. You should start thinking about this, but you've got to make this transition now to decreasing the PPO, increasing out-of-network benefit, increasing your fee-for-service patients. So when the time comes to sale, you would have been set up a year, 2 years, 3 years down the road, and your staff would be set up. This is something very important to think about. Those of you who don't know when they're going to sell but are thinking about selling, you have to be prepared now, because I see it trending. I see the pressure that the dentists that are relying strictly on PPO, what they're feeling, and trying to upsell all the PPO patients, not as easy as you think. So get on top of it, and let's see if we can help you. All right? Opportunities are fantastic out there, but you've got to begin that transition now, because this is what we see what the future is. Great talking. Have fun out there. We have a gloomy day here in New Jersey. I wish it was sunny, but there's sun above those clouds. So have some fun out there. Enjoy yourself. You should have fun every day, as they say, because I'm dealing with twice a month, every month for 14 years. I'm dealing with different disabilities calls from around the country. Every single month for 14 years. And you would hear these stories. I mean, last month or 2 months ago, it was 3 disabilities in a month. Heart attack, brain cancer, acute dementia, everything you could possibly hear of. 45 days from diagnosis to passing away, 45 days of cancer. Can you imagine 45 days is all you got? I mean, that's crazy. All the things you may have wanted to do and didn't do. That's why selling may be a good idea, and you work part-time, But anyway, increase your practice where you can. As I'm telling you, I said on a previous tape, start implementing some of this TMJ. They have new appliances that I'm going to go visit this guy in Texas, and I think he's in Tennessee. It's some new appliance that's patented by the FDA and so forth. So I'm going to get on that. And sleep apnea. I'm selling a doctor's practice, one of the top 15 in the country is sleep apnea. And he's just developed it. Of course, they have appliances for that, but you start getting into that, but getting proper training and so forth. Set yourself up for a great practice to be able to sell TMJ appliances, sleep apnea, reduced PPOs, increase out-of-network benefits, increase fee-for-service. To do that, you've got to work on that now. All right, team, get on. Have a great day out there. Hit subscribe if you want to hear more videos. We're going to be, I think we're close to 600 now, more than anybody else in the country. We're motivated. We're excited. Bye now.